Infection prevention and control training. Next slide. The goals of the infection prevention and control program are to prevent the transmission of infection to not only the patients and the visitors, but also to you, the workforce members. We want to provide a safe work environment. We want to improve patient care and safety. And infection control really is everyone's job. Next. Every department in the facility has a part to play with infection prevention. Everyone is important. Everyone from environmental services to the nurses, to the physicians, to the laboratory, financial services. I find that sometimes the very first eyes on the patient are the registration staff and the security. The methods of transmission. This includes contact, which could be either direct or indirect contact. Indirect would be by touching an object. For example, they're called fomites, but a keyboard, for example. Keyboards can be notoriously dirty. They're known to have more bacteria sometimes than toilet seats. The word vehicle denotes transport of some kind. Here you see pictured someone transporting food. We know that food can be a transmission vehicle for infection transmission. However, in a healthcare setting, vehicle transmission could be maybe medications. If they're not handled aseptically, that could be a method for transmission. Vector, this refers to something like a pest. A pest, for example, name some pests that you can think of. Insects, rodents, sometimes other animals can also be pests. Insects like mosquitoes. There's a number of different types of vectors out there. Airborne and droplet transmission. This sounds similar. The two words sound similar, but they are different. We'll talk more about those in just a bit. Next slide. We can remove the elements of transmission by performing hand hygiene, standard and transmission-based precautions, cleaning, disinfection, and sterilization. This can interrupt the transmission of the infectious diseases. Next slide. Hand hygiene is at the very top of the list of what we should be doing. Practicing good hand hygiene is the very most important thing that any of us can do to prevent the spread of infection. Hand hygiene may be done by either washing hands, that's soap and water, 15 seconds of sudsing, or sanitizing hands with an alcohol-based hand rub. Next slide. When to wash is one question, but also when should you wash versus use the hand sanitizer? If your hands are visibly soiled or you have substance on them, you need to wash. The alcohol sanitizers won't work through substance. Or if they're contaminated with blood or body fluids, whether visible or not, you need to wash with soap and water. After contact with patients or items that are contaminated with organisms such as Clostridium difficile or C. diff, or anthrax or norovirus, these are indications when we need to use soap and water. The C. diff has a spore, the alcohol does penetrate easily, and the norovirus, for example, it's a very hardy virus. There's a similar symptom between the C. diff and the norovirus that some of you may be familiar with. Diarrhea, both of them can cause diarrhea. Norovirus also causes nausea, vomiting, and diarrhea. So you don't know what people have and why they have the symptoms that they have, but what I suggest is that when you encounter patients with these symptoms, that's a good time to wash, as opposed to the hand sanitizer. Some manufacturers will state that after 5, 10, 15 applications of their product, we should be washing our hands. And that's because there's an emollient in these products, which you can get a buildup of it. Sometimes you might, after using it a few times, you might notice you have a bit of a tacky sensation, and that's what that is. So that's another time to wash. After using the restroom, before eating or handling food, these are also other times to wash as opposed to sanitize. Next slide. The effectiveness of hand washing versus the alcohol-based hand rub. It does vary. Plain soap is considered good. Antimicrobial soap is a little better. Both plain soap and antimicrobial soap will wash off the bacteria. Antimicrobial might kill a little bit of it, the antimicrobial soap. However, the alcohol-based hand rubs are the best. They are superior to the other two products because it will actually kill the bacteria on the hands. Next slide. Artificial fingernails are not permitted for staff who perform direct patient care, have direct contact with patient supplies, equipment, food, or medications. And this is part of our hand hygiene practice. Natural nails, if you need to be clean, and with the tips should be less than 1/4 of an inch. Fingernail polish, and we're talking about regular fingernail polish, if it's worn, needs to be in good condition and free of chips. Gel nail polish is actually considered artificial. fingernails in a sense, because as the fingernail grows, the polish stays on, and so in between the nail bed and the edge of the polish, those are crevices, which is almost like an applique, and that's where bacteria can also be harbored. Wearing rings and stones is discouraged. It can also harbor bacteria and tear the gloves. Next slide. The DHS policy for hand hygiene outlines that if an employee is not compliant with the fingernail provision of the policy, they may be sent home without pay and not permitted to return to work until they have complied. Failure to return within 15 calendar days indicates that a person may be subject to disciplinary action and up to including discharge. Next slide. Standard precautions. The film talked about standard precautions, and these are basic principles that are designed to both reduce the transmission from recognized and unrecognized sources of infection. We need to consider all body fluids as infectious. They should be used for the care of all the patients, regardless of the setting or the diagnosis. If used correctly, it will protect both the patient and the healthcare worker. Next. Respiratory hygiene, cough etiquette. The film also outlined the protocols for this, and this is applicable to the patients and ourselves. Cover nose and mouth when coughing, sneezing, using tissues, performing hand hygiene after contact with secretions or objects that are contaminated. Next slide, please. And again, we want to mask the patients and separate the patients with respiratory symptoms. If most of your clinics will be providing tissues and masks in the respiratory hygiene stations, if the patient doesn't have that, we need to provide those supplies for them. And we should triage them promptly and place coughing patients into the exam rooms as soon as possible to remove them from the general waiting areas. You, the healthcare worker, needs to wear a mask when you're in close contact with coughing patients, particularly if the patient has a fever. Next slide. Cleaning, disinfection, sterilization, these are very important. Cleaning will remove the debris. Disinfection will eliminate or kill most bacteria, virus, and fungi. Different levels, low, intermediate, and high. Sterilization, this will actually kill and remove all organisms. But neither disinfection or sterilization can be achieved without first cleaning. Next slide. Check the expiration date of the product. Follow the manufacturer's recommended guidelines. Use the correct dilution ratio and the contact time and temperature. The contact time, what is the contact time? Sometimes it's referred to as the kill time. The label of the disinfectant on the bottle or the container will tell you what the amount of time is that the liquid or solution needs to be wet on the surface in order to disinfect as intended by the manufacturer. That is very important. Next slide. When you're transporting specimens, this should be transported in a leak-proof container that's clearly marked as biohazard. The word biohazard means a biological substance that can cause harm. Please note, these nice containers for the Ziploc bags, for example, with biohazard label, should only be used for biohazard substances. They should not be used for storage of any other items such as food, medication, clean, or sterile items. Next slide. Sharps disposal. Notice in the film where it may have indicated there was a sharps syringe and needle in an open trash can. Healthcare workers are taught to never ever dispose of sharps in any kind of open trash can. It always needs to be in a labeled leak-proof sharps container, never a regular waste container. We should also never bend or recap or break contaminated sharps, and if you ever need to recap, it should never be done with two hands. It needs to be done with a one-hand technique. Next slide. And you need to become cognizant of the fact that the sharp safety devices need to be activated. In the absence of a built-in safety device, we need to find another way to cover the needle so that it can be disposed of safely. Make sure it drops into the container, and whenever the sharps container is 3/4 full, that's when it's full. Never allow it to become full, because then it may overfill and then be a risk. Next slide. Safe injection practices. The film talked about this also. One needle, one syringe, one time. We need to consistently practice these precautions of never administering medications from the same syringe to more than one patient, even if the needle is changed. And we always enter a multi-dose vial with a clean needle. Items such as an IV bag should always be considered one-time use. And single dose means single dose, single one-time patient use. Always use aseptic technique. Next slide, please. Transmission-based isolation precautions are used for caring patients who have been diagnosed with or are suspected of having a contagious disease. Next slide. Contact precautions. Transmission occurs by direct and indirect contact with the patient or with contaminated surface. Examples of illnesses that may need contact precautions is MRSA, or multi-drug resistant organisms, herpes zoster such as shingles, scabies. Some of these illnesses can be cared for, the patient can be cared for using standard precautions, but if it's a situation where containment is not as feasible, then contact precautions should be considered. You wear the protective gear such as gloves and anything else, like gowns or goggles, if splash is anticipated. Next slide, please. Droplet precautions. These are microorganisms that are transmitted by the patient during coughing, sneezing, talking, or procedures such as suctioning, where droplets may be dispersed into the environment. Examples are flu, cold, pertussis, mumps, meningitis. The patient should be given a mask, and you, the healthcare worker, should wear a mask when you're within 3 to 6 feet of the patient. Next slide. Airborne precautions. These microorganisms are smaller microorganisms, and they're transmitted by smaller droplets, airborne nuclei. These smaller droplets can remain suspended in the air for long periods of time and be dispersed by air currents within a room or over long distances. Examples: measles, tuberculosis, chickenpox, novel flu. What is a novel flu? It's different from a regular flu, and only that it's new. The word novel means new. The first year that flu appears into this population, it may be considered novel, and it needs to be followed, cared for with airborne precautions until it's better understood, and then it may be downgraded to a regular flu. For airborne precautions, we need to place the patient in a private room, negative pressure if available, and keep the door closed. Healthcare workers should wear an N95 particulate respirator. The patient always wears a regular mask, but the healthcare worker would wear the N95. Next slide. In addition to following the droplet or airborne precautions, you also need to follow the standard precautions, because these illnesses can be transmitted by both direct, indirect contact and by airborne or droplet nuclei. The only exception would be tuberculosis, because that's only transmitted by airborne process in our clinic setting. Remove the N95 after you've left the isolation room. And even if you think you're immune to an illness, you should still wear the protective gear of the mask, goggles, and the N95. Next slide, please. For any isolation that you initiate, you should be posting an isolation sign on the door or the cubicle. Airborne always needs a private room, but droplet or contact can be in a private room or in a cubicle. If the patient needs to be transported or directed to another department, notify the receiving department. They want to know of the precautions as well, because they also need to follow them. For airborne precautions, one aspect is that you need to remember to keep the room door closed for 1 hour after the patient leaves. That gives the room time to ventilate the contaminants out of the room. After the hour, that's when environmental can go in to clean. And this is only for airborne. Droplet and contact, you don't need to wait that hour. Next slide. Aerosol transmissible diseases. It's a mouthful, but it stands for illnesses that are transmitted by either droplet or airborne and require that type of precaution or isolation. It's abbreviated ATD. Examples: cold, flu, meningitis, TB. These are all different illnesses that are transmitted by aerosols. Assess the patients for ATD symptoms when they enter your facility. Patients with a suspect or confirmed ATD are to wear a surgical or barrier mask. The workforce member will wear either the N95 for airborne or the surgical mask for the droplet precautions. Next slide, please. ATD exposures may occur when the appropriate personal protective equipment and the isolation precautions are not used. For example, if you're in the same room with or performing direct patient care tasks on a suspect or confirmed ATD patient, or if you're performing a task that will disperse the pathogens into the air, such as suctioning, for example, or if you've entered the room of a patient that was on airborne precautions after the patient left, but it was within that hour before the room had been cleared yet. Those are all potential opportunities for exposure to another person or to yourself. Next slide. If exposure does occur, notify the supervisor of the exposure promptly. The supervisor is then to report the exposure to Employee Health Services or Infection Prevention Office. You should report promptly or immediately. They need to report at least within 24 hours or sooner. Some illnesses have a very short incubation time. Workforce members will be then screened and or referred for treatment as indicated. Next slide. A powered air purifying respirator called a PAPR. These are used when an N95 is not available or the workforce member is not a candidate for fit testing or was not successful with the fit testing. It's used primarily for high hazard procedures when a task is being performed on a patient with a suspect or confirmed airborne ATD. Next slide. Some examples of high hazard procedures are sputum induction, pulmonary function testing, aerosolized administration of medications, surgery or laboratory procedures that may aerosolize pathogens. Normally we would not be using these PAPRs in our surgical setting. Rather, it's may be used in other indications. Surgery generally would not use a PAPR. If you the PAPRs are stored in designated areas. Your facility may not have any, and so then other precautions would need to be followed in that instance. Next slide. Tuberculosis. It can be spread in healthcare settings. It's primarily spread in the community. That's where it comes from. But it can spread by close, prolonged, intense, unprotected contact indoors to an active TB patient. It's spread through the air in small droplets, and these can stay suspended in the air for hours. Employees are screened annually for exposure to tuberculosis. Next slide. TB precautions for suspect or confirmed patients includes early triage, identification of a patient who may need to be isolated. Mask the patient. That's the very first thing to do. And particularly if they're outside of an isolation room or in an enclosed area. For airborne isolation, this is the precaution we follow. Keep the door closed at all times. Negative airflow room if it's available. If unavailable, place the patient in a private room and then transfer them out as soon as possible. You, the workforce member, would wear the N95 particulate respirator. Next slide. Employees are provided vaccines to protect them from exposure to different pathogens: hepatitis B, varicella, for chickenpox, MMR, measles, mumps, rubella, Tdap, that's for pertussis and tetanus, and the flu vaccine. All of these are provided to employees. The hepatitis B vaccine is only provided to employees who may be exposed to blood or body fluids, but all the others are provided to all employees. The varicella and MMR are actually conditions of employment and mandatory in some of our DHS settings. Next slide, please. Influenza itself is a significant illness that can cause death each year. As healthcare personnel, you are at increased risk of acquiring and transmitting this illness. The most effective strategy to prevent it is the annual flu vaccine. Next slide. Annual compliance with the influenza vaccination policy is mandatory for all workforce members in our DHS healthcare facilities. This includes county, contract, vendors, students, volunteers, everyone. And all staff, whether they perform direct or non-direct patient care, who do not receive the flu vaccine each year must each year sign a declination form and wear a surgical mask starting November 1st through the end of flu season, which could extend to April or May or even June, when they are working in patient care areas, except for other designated break areas. Next slide. Masks should not be worn around the neck for repeated use. You should change them out. And once it's removed, discard it. Get a new mask, and we will provide them. You don't need to purchase them. We will provide the mask for you. Next slide. Multi-drug resistant organisms, MDROs, These are organisms that have a strain of bacteria that's resistant to the common antibiotics that we use to treat infections. Examples are MRSA, VRE, KPC. There are others. Next slide. The prevention strategies to reduce the incidence and the risk of transmitting the MDROs includes hand hygiene, standard precautions with all patients, cleaning, disinfection of equipment and environment, contact precautions with patients infected, and education of the patients and their families on how to prevent the spread. Next slide. If exposed, immediately wash or cut. If exposed, immediately wash the cut or exposed skin area with soap and water. Flush your eyes or mucous membrane with water or normal saline for a minimum of 2 minutes. And most important, in an outpatient setting, we need to remember to instruct the source patient to wait for further instructions. Once we've given them an injection and we got stuck, they're on their way out the door. So we really need to inform them to please wait for further instructions from a supervisor or a designated person so that we can ask them to be tested, because that's the question we have in our mind. What might the patient have that we may need treatment for? As soon as you've washed, instructed the patient to wait, report to the supervisor, then complete the forms that you're provided, and then receive medical follow-up per your facility protocol, which could be employee health, urgent care, or the emergency room. The reason we're doing this in immediate manner is that because the treatment is most effective when started within 1 to 2 hours of exposure. That's for your benefit. Next slide. Healthcare-associated infections are transmitted within a healthcare setting. Ambulatory healthcare is increasingly providing care to vulnerable patient populations. Outbreaks in ambulatory care settings have been associated with breakdowns in the basic infection prevention practices. All healthcare settings, regardless of the level of care provided, needs to make infection prevention a priority. Next slide. We will monitor compliance for some of the recommended requirements for infection prevention, which includes hand hygiene, the respiratory hygiene, cleaning, disinfection, sterilization, care of the environment, and other practices for infection prevention, standard precautions, and so forth. Next slide. If you are exposed to blood and body fluids, you need to report immediately to your supervisor and then to employee health. Aerosol transmissible diseases should be reported within 24 hours. You should report to your supervisor promptly. Supervisor should report to employee health as soon as possible, within 24 hours. Other infectious diseases should also be reported promptly. Report to your supervisor or seek medical attention from your private healthcare provider if you have evidence of infections that could be transmitted in the workplace. And notify the employee health or infection prevention if it can be spread in the workplace, and it has potential that has happened. It's important for you to come to work healthy. Please don't place others at risk. Next slide. Remember to do your part for patient safety. Follow good hand hygiene practices. It's the most important thing that any of us can do to prevent infection transmission. Next slide. Any questions?